Hi, I'm Kristen Ochsner, a physician assistant at Skin and Beauty Center in Burbank, California, and I'm going to talk a little bit about melasma. Melasma is a really common skin condition that can be extremely frustrating and embarrassing to patients. It causes a brown to brownish grayish patchy discoloration of the skin, usually on the face. The typical areas it affects are the upper lip, the forehead, the cheeks, but it can occur anywhere on the body. It's most commonly seen in patients with darker skin colors, but it can affect anybody of any skin color. It also commonly affects primarily women, but men can also get melasma. We don't know exactly what causes it, but we do know there is definitely a hormonal component to it. It usually increases during pregnancy and with any hormonal therapy like oral birth control pills. There's also a genetic component to it. Typically you'll have another member of the family that will have it. And then sun really plays a big role in darkening the splotchiness and the dark patches. It can be extremely difficult to treat and very frustrating for the patient. It oftentimes is hard to cover up with makeup because it's so blotchy. But there are some treatments out there. They don't work for everybody, but they're definitely going to help to lighten the melasma, if not take it away completely. Anyone who's prone to melasma needs to first and foremost really protect their skin from the sun, because that will definitely make it worse. So use a broad spectrum SPF 30 or higher every day and reapply it often, especially if you're going to be outside for long periods. We can do several things to help diminish the melasma once you get it. Sometimes it'll just fade on its own and you don't need to do any treatment at all. If it doesn't, topical treatments usually consist of a bleaching cream. Those can be either bought over the counter or they can be bought in stronger strengths as a prescription from your doctor's office. The other option is chemical pills like glycolic and salicylic acid, TCA pills. Microdermabrasion sometimes will benefit the patient. There are laser treatments that will help most cases. Typically we have to do a combination of these things, and what works for one patient may not work for another patient. So it's really frustrating for the providers too to really figure out what's going to work for each patient. Melasma, unfortunately, is extremely stubborn. It recurs. So if you've had it before and it's faded away, likely you'll at some point in your life experience it again, especially if you get pregnant or are on birth control or get an excess amount of sun. So again, sun protection is the #1 key in melasma. If you have any questions about melasma or any other skin conditions, you can visit us at dermla.com, or you can give us a call at 818-842-8000. Thank you.